the community in mobile sites and at standalone centres, a project has increased access to HIV counselling and testing. Over a period of 5 years, teams have fanned out across 5 communities in and around Cape Town, bringing services closer to the people. It's also in line with the global 90-90-90 campaign, which aims to diagnose 90% of people living with HIV by 2020.
The Community HIV/AIDS Prevention Project, known as Comapp, is implemented by the Desmond Tutu TB Centre at Stellenbosch University, and we work in close collaboration with our government partners, City Health and the Western Cape Department of Health, and 4 different NGOs: Siza Kuyenza, Living Hope, Masasindani and Etafeni.
Comapp's been founded by PEPFAR through the Centres for Disease Control and Prevention, CDC. The project's become recognised for its red mobile van and tents. This site, in the heart of Nyanga in Cape Town, is set up alongside a busy street. Comapp has particularly targeted people who don't usually go to clinics, such as men, couples and young people. The walk-in service has made it easier for people to find out their HIV status without having to wait in long queues.
I feel so happy because I know my status. Yeah, I'm happy.
Apart from an HIV test, clients are offered TB screening, advice on sexually transmitted infections and family planning, condom demonstrations and free condoms. They can also find out their weight and height and get blood pressure and glucose tests.
Now I'm going to check your blood sugar.
Okay,
Okay, sweet.
Men are also offered advice and referrals on medical male circumcision. Seeing so many men at mobile testing has been very encouraging.
Almost half the people we tested were men, which is significant because typically men don't access health facilities.
HIV, TB, high blood sugar, test for free, test for mahala.
At the standalone centre in Kraaifontein, a special men's clinic on Mondays has drawn men in their numbers, while in all sites, the Desmond Tutu TB Centre and the NGOs have blended their skills and strengths, with the project bringing the message home about HIV prevention and treatment.
The partnership with the University of Stellenbosch in particular was very valuable to Etafeni. It made a fundamental contribution in our communities in terms of the prevention of the HIV and AIDS and other related sexual transmitted diseases, as well as around early sexual activity prevention around that, and also dealing with other very difficult issues that families and teenagers deal with.
The NGOs have been an important link to the community.
They understand how the systems work in the community. They even have links with the community advisory boards. So really, they can indicate to us, this is the right area that you need to work in, and they almost give us a pathway into the community.
Being so close to the people has had many benefits.
It's totally different from a hospital setting. You have time to explain to clients their needs. You can comfort clients. You can just be there. You can listen to them.
Along the way, Comapp team members have developed a wide range of new skills.
We had a lot of couples counselling and update couples counselling. There was a lot of training on data management, professionalism in the workplace as well. Our nurses were upskilled with family planning, and some of them even have their dispensing license now at the end of the project.
It should stand them in good stead for the future.
Leaders create leaders, and I think that's what they did in Comapp. Everyone's been upskilled, doesn't matter on what level you came in. They can go out and actually find something new and move on with their careers, and yeah, that's fantastic.
For Cape Town City Health and the Western Cape Department of Health, the project has been insightful.
Comapp really helped us in 2 ways. First of all, to help achieve here and now the coverage around HIV testing. So in every year that they've been operating, they've contributed very substantially to the number of people testing, and therefore the proportion of the population that's knowing their status. But secondly, also to provide evidence of new models and ways of doing it that will help us to reach men and young women and girls especially.
The teams have taken their work to heart.
It drives me to wake up every morning to come to work because I know I'm going to do what I do and what I love best.
Even if that means working in pouring rain and wind, and sometimes even in dangerous situations.
For instance, last week Thursday, I escaped the attempted hijack. I had to run away with participants.
The project has risen above the challenges and reached a record number of people.
We counselled and tested more than 93,000 people, which was way above our target of 85,000. We've diagnosed more than 4,000 people with HIV and confirmed that 65% of these have linked to care.
Comapp was also one of the few organizations chosen to present to US President Barack Obama when he visited South Africa in June 2013. The Families Matter program has dovetailed with the HIV counselling and testing services. Held at Etepheni and Nyanga, mobilisers have been door to door in the community, encouraging caregivers to attend a 6-session course. It's aimed at parents and caregivers of children aged 9 to 12. Facilitators have worked with caregivers on how to communicate with their pre-teens about sex and sex risk education.
When we run these sessions, we are imparting knowledge, we are imparting skills, we are giving these parents information. The idea, therefore, is to ensure that when they leave the session, get home in the evening, when they're sitting with their kids, they should be able to impart that same knowledge.
Caregivers have soaked up the experience.
Parents, they normally say, all these sessions, they've changed our lives. Our home life, our personal lives, our partner's life has changed ever since we started Families Matter.
By the end, more than 900 caregivers had graduated from the Families Matter program, a fitting close to the overall Comapp project in Cape Town.